Okay, guys, Dr. Thomas back once again. Yes, you know I wouldn't leave you for long. Okay, we're finishing up the chapter on antibiotics. What was it? Unit 15. Okay. We said until recent times, in the human experience, that microorganisms was leading cause of death, and they still are the fourth leading cause. Now, this says in human beings, so that means around the world also where there's not as much sanitation, perhaps in some areas. 50% virus related. Over 600,000 Americans died from coronavirus last year, or maybe since it's the start of it. Okay, we said that infection is a pathogenic agent, invades the body, multiplies, and produces injury. Now, guys, it's important to understand the word pathogenic. It means disease-causing, because there are a lot of bacteria that are not pathogenic in nature that we have to have for survival. Believe it or not, there are more bacteria in the body than there are cells in the body. I know that's hard to believe. When I first saw that a few years ago, because they didn't know that when I was in school, I was just blown away. I thought, oh, that can't possibly be correct. There's trillions of cells. Well, there's trillions and trillions of bacteria. However, some of them can become pathogenic and be very serious. Defense mechanism. The body is equipped with built-in defenses, like intact skin. If you have an open sore, then you got to open an invitation to get in secretions that help mucus and so forth in the body, the entrances to openings in the body. White blood cells, of course, play a huge role. Body chemicals, antibodies, which are produced by one of the white blood cells. Infectious disease is one of the world's top 3 killers, along with heart problems and cardiovascular disease, be a better way to put it, and cancer. Infectious disease is second, 16.2 of all diseases worldwide. So it's still a huge problem, huge. Okay, one of the biggies, guys, is this MRSA. This is pronounced MRSA. This is real important. You need to know this. Methicillin-resistant Staph aureus, or Staphylococcus aureus. That's the skin, the bacteria on our skin. We are covered with bacteria, guys. We're supposed to be. If for some reason we lose some of the bacteria on our body, it allows things like fungus and stuff to get in there and settle in, which is a lot more problematic. So, in a nutshell, very quickly, they meaning the doctors, scientific, and everybody, has overutilized antibiotics, terribly so. And so what it's done is developed species and strains of bacteria that are resistant to most of the types of antibiotic treatment that's available. So they basically can't cure this stuff, or they have a hard time. This MRSA is a big one. This is the one where some dude goes in the hospital for some minor procedure and catches this bacterial infection and it kills him, or almost does. That's this one. So this is real important. It's caused by overutilization, guys. Let me say this. Every time you take your kid to the doctor and there's a viral infection going on and you demand the doctor give you antibiotics, you're adding to the problem. Why? Because antibiotics don't kill viruses. They're only good against bacteria. But there's a lot of patients that demand them. There's a lot of doctors that give them out anyway. That adds to the problem. Okay, Clostridium difficile, E. coli is one of the common bacteria in our intestine. Salmonella, Campylobacter, Strep A and B, SARS. Okay. Antibiotics used to treat bacterial infections. Remember that. Antibiotics are only effective against bacterial infections in animals, plants, and humans. Bacteria can be gram-positive, gram-negative, or acid-fast. Okay, let's talk about that, because they're doing a very poor job of it here. There are many, many, many different kinds of bacteria. One of the big, broad ways of cataloging or classifying them is whether they can take the gram stain or not. Guys, a lot of this stuff is transparent when you look at it under the microscope, so you have to stain it with something to make it show up, or you don't just look through it. And a very common and historic is called the gram stain. Gram-positive means that the bacterium will take the stain. Gram-negative, it won't retain it. So these are used as broad categories. Like you'll hear doctors say, oh, well, it's a gram-negative Staphylococcus aureus that we're dealing with, and that kind of thing. Acid fast means stay even when treated with acid. Okay. These are the biggies. Big classification categories. Gram-positive and gram-negative. Classification, broad-spectrum antibiotics kills all kinds of stuff. The bad thing is it kills the good stuff along with the bad stuff. Narrow spectrum limits the type of microorganisms it works against. Extended spectrum covers Pseudomonas, Enterobacter, and Proteus species. If they know what it is, guys, if they have time to culture it in the laboratory, then they can give a narrow spectrum drug to treat it specifically. But often they don't have time to do that, or the patient's quite sick, so they give a broad spectrum. The problem is it kills off, in addition to the pathogenic bacteria, which we want to kill off, it affects the bacteria in our colon and stuff, and causes digestive upsets and diarrhea and all kinds of things. Administering antibiotics, check for allergies. Remember I said that before. Look on the patient's chart. There'll be a big orange or red note. Allergic to. Allergies to penicillin are quite common for some reason. And all the drugs that are based on the penicillins, like methicillin. Culture and sensitivity should be performed before starting antibiotics. Culture is where you find out what kind of bacteria it is and what it's sensitive to. But as I just said, guys, you often don't have time to do that. Yeah, in a perfect world. Other than that, no, man, they whip out that pad and they start writing, okay, we're going to give you Of course, oftentimes they know from experience what it is and how to treat it. So this is in a perfect world, but you should be performing hell. Guys, patients are seen all over the world, all over the United States, and are given a routine antibiotics. That's nonsense. Effective antibiotics must be harmless to the blood, liver, bone marrow, and kidneys. Low possibility of toxicity. Effective against invading microorganisms. Must be more beneficial than harmful. Adverse reactions, hypersensitivity, organ toxicity, superinfection, associated diarrhea. Again, this comes from the killing off the E. coli and other bacteria. Antibiotic overuse can result in drug-resistant strains of bacteria. Yes, like MRSA. Major antibiotic groupings: penicillin, cephalosporins, carbapenems, tetracyclines. These will turn your teeth gray. Aminoglycosides, quinolones. Additional microglides, monobactums, axilla something, streptogramus. See table 15.8. Sorry that some of these I'm a little weak on how to pronounce them. Penicillin was the first one discovered. It was discovered accidentally by the great scientist and Dr. Alexander Fleming. He got bread mold into his petri dishes with bacteria, and he went on vacation. He come back and found that it killed it. It inhibits the development of the cell walls in bacteria. Now, we have membranes around our cells, but they have walls in bacteria. Special consideration: take on an empty stomach, take with 8 ounces of water, do not take with soft drinks, fruit drink, or wine. Administration with erythromycin or tetracycline may diminish effectiveness. Since then, they've synthesized and made a great deal more. Cephalosporins, take special considerations: take on full or empty stomach, may be crushed or mixed with food, may cause false urine sugar test results, may avoid alcohol consumption. Guys, I've known of some people, indirectly, who were alcoholics, and they were serious alcoholics, really knocking them back. And it will interfere with the action of antibiotics. And I knew one guy that injured himself in training in World War II, and later had to have his leg amputated. It was like years later, but he was a heavy, heavy drinker. Carbapenems, contraindications known: hypersensitivity, same place as drugs. Patients with demonstrate anaphylactic reactions to beta-lactams. Okay. Tetracyclines, contraindications: children are 8, pregnancy or lactation, renal or liver impairment. They will turn your teeth gray. I've seen people with them. Right here, permanent discoloration, deciduous teeth. Well, the people I knew were grown-ups and they had gray teeth. They said, yeah, they put me on down tetracyclines when I was a kid. Take on empty stomach, and yes, water, not take with dairy products, calcium, antacids, or iron. I think you need to stay out of the sun, too. I'm not sure. Now, guys, of course, if the person is badly sick, you can put up with great teeth. But if it's just some slap-happy doctor was writing too many prescriptions, that's a different situation. Does that kind of thing happen? Ha ha ha! Oh, do you have a lot to learn? You darn right it does. Aminoglycosides, contraindication, Labyrinth disease in the ear, myasthenia gravis, is a disease that affects voluntary muscle movement, characterized by drooping eyelids. Pregnancy or lactation, cautious use in renal impairment, elderly, infants, or children. Aminoglycosides can cause permanent damage to the acoustic nerve, hearing. Observe for ototoxicity in the ear or nephrotoxicity, which are the kidneys. Drink plenty of liquids to reduce development of nephrotoxicity. Macrolides, ketolides, erythromycin. I know that's a real common one. Erythromycin, carcilomycerin. Okay. I don't know how to pronounce this. New class of antibiotics attacks bacteria by stopping protein production. Most of them interfere with cell wall synthesis, is my understanding. This was different. Special considerations: don't combine with over-the-counter meds containing pseudoepinephrine. Okay, antiseptics and disinfectants. There's a difference. Antiseptics are used on the skin and the body tissue. Prevent or inhibit microbial growth, bacteriostatic action, like alcohol prep, you wipe. Disinfectants are used on objects and surfaces. And the one that's most commonly, guys, used in the medical field is a bleach solution. Chlorine bleach is deadly poison. Used on objects, it kills vegetative forms of microorganisms, bactericidal action. Bacteriostatic means it slows down the growth. Bactericidal means it kills them. So antiseptics are used on people, disinfectants on surfaces, counters, toilets. Bleach, recommended by OSHA, Occupational Safety and Health Administration. It protects our workplace more than any other disinfectant in medical dental practices. Yes. A 10% bleach solution, 1 part bleach, 9 parts water will kill anything. You don't have to use and don't want to use pure bleach. Replace solution after every 2 to 3 days. Inactivate HIV with a 10% solution. Decontaminate surfaces with a 1%. Yeah, that's hardly any bleach at all, but 10% is usually what's recommended. All right, guys, we did it. Go back over this, look at those tables, read the material. Go back over these videos, these lectures of mine here, guys, and watch them 2 or 3 times. It'll help. All right, hang in there. Make sure you do your homework. If it's a week, well, this week we don't have a test. Week of test, make sure you do the test. All right, let me know if you need anything. Dr. Tom is signing off. See you next time. Be there or be square.